Ngingenile shiqi enyangeni lapho kubanda khona. Njengoba sazi ukuthi abantu mabelala balala namabhodlela anamanzi ashisayo, abanye bakhanyisa amahitha, abanye bakhanyisa imbawula baze balale nazo endlini. Kanti lokhu kugcina sekushile kushe indlu, kanti futhi beshile nabo emzimbeni. Kanti ke ku Dr. Prue namhlanje sidecide ukuthi ake sibe nehambeli zethu esizosichazela kabanzi ukuthi ngabe ukusha ngaphandle kwalokho mina sengikhulume ngakho kungabe kubangwa yini, kanti kubakuthita kanjani noma kufanele wenze njani uma ushile. Njengenjwayelo ke angihambi ngedwa, ngihamba nabo kodokotela. Singaqala ngayo uDr. Pam akasichazele ukuthi uDr. Pam uqhamukaphi, usebenzaphi nokuthi uvela kuphi kahle hle.
Ngibingelele kini nonke sinabo njengamanje kule platform nabo bonke ababukele. uDr. Pam uPamela Mathebula, intombazane ebuya eThekwini elokishini elincane kuthiwa kwaNdengezi, eyenza izifundo zayo eziphansi zezobudokotela e-UKZN, then ngaspecialize in general surgery e-University of Pretoria. Njengoba ngishilo ngi-general surgeon, kodwa nginothando oluthe ukuba ngaphezudlwana uma kuza kuma-burns or kuza action. Njengamanje ngizinze kakhulu in private la ngisebenza khona Acacia Hospital, which is a net care, naseButilong, which is a clinics group. Kodwa ngiyasebenza naseKalafong Hospital la kuyikhona ngisebenza khona kakhulu specifically ngama-burns.
Sibonga kakhulu Dr. Pam ukufika kuma studio ethu. Kanti ngifuna ukwazi nje njengodokotela womfazi othanda ama-burns, ngavele ngithe mangifuna udokotela bathi uyi-one dokotela othanda ama-burns, and ngiyaqala ukubona udokotela special womuntu wesimami. Uthi yini ekwenza ukuthi uthanda ama-burns kangaka?
Ngiyacabanga ukuthi into engidonsele kuma-burns ukuthi abantu abaningi angazi ngithi bayawasaba noma abawathandi. Vele njengomuntu onjalo ngiyayithanda ukuhluka ebantwini abaningi. So yona into yokuqala engidonsele kakhulu la kuma-burns number 1. Okwesibili ke kodwa ukuthi nginale nkolelo ekutheni uma kuukuthi yonke into siyenze kahle kusukela ekuqaleni isiphetho siba sihle. Uma yememe impilo iba mnandi.
Sibonge Dr. Pam. Sister Mirriam, ungake uchazele umbukelo osekhaya ukuthi ubani uSister Mirriam kanti usebenzela kuphi sisi?
Nginibingelele ke balaleli ezempilo. Lokhuluma ngoke nguSister Mirriam Zahoor ngokuqala emndenini wakaLubisi le endaweni yaseNkomazi eShuzindala. Ngitheke nangitelwe endaweni yaseNkomazi eShuzindala ngase ngimuvela nganeno eWhite River like 18 years ago ngase ngitraina enursing. Nangitraina enursing ngayosebenza eMediclinic as a scrub sister e-theatre. Ngisebenze kakhulu as a scrub sister e-Mediclinic theatre kwasi 2016 ngahamba ngayosebenza eBusamed solo as a scrub sister. Then 2018 la decide khona ukuvula i-practice yami. So nangivula i-practice yami bengivulela because I did an degree on occupational health. So bengivula i-practice because I want to do ama-medicals and as a primary health care. So kwathi bodokotela lebengisebenza nabo ke la kuma-private hospital bathi Sister Boni, bangibita nga-Sister Boni ke. Sicela ukuthi usendele ema-wounds because you know the sterility ezusebenze kakhulu e-theatre. Sithathanda ukuthi usendele ama-wound ethu. Base ke bangirefera to one company lekuthiwa kuSmith and Nephew. uSmith and Nephew wase ke uyangitraina as an advanced wound sister. So as an advanced wound sister, so I'm dealing with all types of wound. So kwamanje ke ngisebenzela eMsholozi kul one village next to White River. Ngola ipractice yami khona ngenza kona ama wound, all types of wounds, ama burns, ngenza primary health care, occupational health, and I'm doing many more.
Asibonge Sister Mirriam.
It's okay.
Sinodokotela futhi ngaphakathi kwama-studio ethu uDr. Nombulelo Metuse. Dr. Nombulelo, umbukelo sekhaya ungathi uwe ubani kanti usebenzela kuphi uqhamuka kuphi sisi?
Okay, ngiyazibuyisela kubo bonke ababukela abasekhaya nakubo bonke abantu abalathi la e-studio. Mina igama lami nguNombulelo Metuse. Ngisuka e-Eastern Cape, ngifunde khona amabanga amaphansi and then mase ngifunda ngudokotela ngawufunda eMedunsa. Mase ngiceda lapho nga-specialize as a plastic and a reconstructive surgeon e-University of Pretoria. So khona manje ngi-based khona lana ePretoria e-One Military Hospital ngiyisoja. And then a private ngiya Mulmet Mediclinic, Medfora Mediclinic nase Buthilu, and then nase Steve because ngisaya khona ngiyenza abantwana especially ababe benzi craniofacial ama clefts. I'm passionate ngakho. So yeah, that is me.
Sibonge kakhulu Dr. Metuse.
Okay.
Miss T, wona waziwa ngo-Miss T. Namhlanje ke ngicela uchazela ababukeli ukuthi ubani uMiss T, kanti usuka kuphi, utholakala kuphi futhi.
Ngibingelela nonke enikhona kule program, ngibingelele nababukeli. Njengaziwa ngo-Miss T, is my nickname from school, nguThembi Maphanga, dawuka eWitbank, kodwa okwamanje ngihlala eMiddelburg as I'm working in Middelburg in one of the mines in the engineering field. And ngikhulele eWitbank, ngize ngapha ngizofunda ama-learnerships, ngase ngithola umsebenzi eMiddelburg.
Okay, sibonge Mrs. T. Dr. Mathebula, ngicela ukusichazele kabanzi nje ukuthi ngabe ama-burns ukusha kubangwa yini kahle hle?
Bonke Dr. Prum, ama-burns ziningi izinto ezenzayo, kodwa esizijwayele kuyaye kube izinto ezifana namanzi, amanzi ashisayo, noma njengoba kusuke washo imbawula iyaye cause ama-burns, kodwa lawo ma-burns wona kuba awomlilo ngoba kusuke kusha izinto ezingaphakathi endlini la umuntu esuke khona. Bese kuba khona izinto ezingajwayelekile kodwa nazo ezishisayo njengogesi, bese kuba futhi nama-chemicals. Ama-chemicals kungasuka from into efana ne-hair relaxer, into esingeke size siyinake, kodwa iyashisa and ishisa to an extent yokuthi iyakwazi ukuthi ishiye iska. And then bese kuba khona ke amanye ama-chemicals ke lawo sesiwathole ey'nkampanini okumbe embonini ezinkulu esiyibiza ama-large chemical plants. Bese enye into eyayikhoza ama-burns esingayinaki ilanga, sunburn into eserious. Abantu abaningi abayinaki uyaye uzwa abanye behlekisa ngokuthi black don't crack ngoba uthi umuntu ngoba vele ngimnyama ngizosha kanjani. Kodwa uthuke ukushona kwelanga mawuthi uyazizwa isikhumba sakho sibuhlungu mawuthi uyathinta noma uthi uyazigcoba noma uthi uyageza ngoba nina ngoba uhlale kakhulu elangeni. Kodwa ke i-sunburn ayihluphi kakhulu ngoba yona ishisa nje kancane, which is what we call a first degree burn. So ingakho abantu abaningi bangayinaki, kodwa inkinga ngayo ukuthi ngokuhamba kwesikhathi then ke ingasikhozela umdlavuza wesikhumba or njengoba baye beshoka belungu bathi skin cancer. So izinto ezifana nalezo ke nje eziyaye zikhoze ama-burns. Kodwa uma uthatha ubuyela kuloko ekushilo mangithi njengamanzi, akusiwona amanzi kuphela, abanye baye bashisa amatiye. Umunye akutshela ukuthi benkade ngithi ngipheke umdoko ekuseni wachitheka wawibhode lawela onyaweni or lawela emzimbeni, into ey'kanjalo. So noma ngabe yini engakwazi ukuthi ibile ingakhozela as well ukuthi ushe ube nama-burns.
Sibonge lapho dokotela. Mrs. T, ungabe usichazele nje kabanzi ke ukuthi wena ukuze utholakale ushile ukwenza kanjani ukuthi ushe or washiswa yini sisi?
Okay, ukuqhubeka ngokuzi-introduce uThembi Maphanga with gender-based violence and burn survivor and an activist today. Deciding ukuthi ngibe yi-activist, it's due to through izinto engigowisha kizo empilweni. In 2010, ngaba ne-argument with my partner, ubaba wabantwana, wase udecide ukuthi asivalele kamareni asishise. So usivalele lapho, wakhanyisa imatress, wasishiya lapho, wahamba in a locked room. Luckily enough, I managed to phuma ngefestere lelo aphume ngalo nami in flames and everything. And back then I used to wear wigs and all that. So umlilo ubugijima nje in seconds emzimbeni wami. So ngazithola ngiyozicima ngilo ngepompi amanzi, of which I had few seconds to decide because I didn't even know what to do. So saving us, me and my daughter, it was a thing you would have few seconds with me in khonile ukuphumela ngaphandle ngazithela ngamanzi, of which I know it wasn't the right thing now that I know better. Base abomakhelwane bayabona ukuthi indlu yasha, beza bazorescue umntwanami lo beka 2 years old. And then from there sasesiniswa ey'bhedlela ezihlukene.
Okay. Sibonga kakhulu Mrs. T, indaba yakho ibuhlungu kakhulu and ngiyajabula ukuthi ngalokho okwenzekele kuwe now you are an activist ku gender based violence. Sithemba ukuthi nabantu abazobelalele namhlanje bazoshintsha especially kubobabe when it comes to lento ye gender based violence. Dokotela Pam akusiqhubeke lapho nangu useyibekile indaba Mrs. T washa ngomlilo sho ukuthi yena. So ushilo ukuthi ama-shpens ayahlukahlukana uthe ubale ku first degree ake singene ke manje impawini zakho ukuthi ngabe ukubonakala kanjani lokusha ukuhlukana njengoba nikuhlukanisa ngama degrees ningobodokotela.
Okay, ama-bands okwahlukanisa ngama degrees akusikona ukuthi siwahlukanisa ngama degrees ngokuthi adalwe yini, kodwa siwahlukanisa ngama degrees ngokuthi ihambe kangakanani esikhumbeni, ngoba ukusha akusiyona lento esiyibona ngaphandle kuphela. Ukusha isikhumba and isikhumba makuthi abanye bethu bayazi ngoba ngithi senze i-anatomy ne-physiology or histology la bechazela khona ukuthi isikhumba akusisona nje isikhumba, sinama-layer. So ama-degrees ke lawo adependa ngama-layer or ngama-levels esikhumba ukuthi ke ifike kuphi la bese ke we must decide ke ukuthi umuntu uno first, second, third or fourth degree burn. Bese enye into ke before ngigxile kakhulu kuloko ukuthi ama levels lawa or ama degrees ama burns ahlukana ke ngokuthi ushiswe yini. So uma sibuyela ke ekutheni uma une sunburn for instance, sunburn liyaye cause i first degree burn. Okusho ukuthini lapho kusho ukuthi usha nje isikhumba ngaphezulu kuphela lokhu obonayo nalokhu okuzwayo. So akujwayelekile ukuthi uma ushiswe yilanga kudlule any deeper than that. So it's what we call an epidermal burn or a superficial burn of first degree. Bese kuba khona second degree. Second degree usuke sewudlulela ke kwi-layer yesibili yesikhumba la isuke isifuna udlulela nala kuba khona nefutha kancane. So lapho isuke seyiqala ke seyithi ukuba diphanyana ile. Kodwa nakhona u-second degree bese ke uphinda uhlukaniswa ke kabili u-A no B ukuthi ke ikude kangakanani or iseduze kangakanani nefutha. Ukuze ukwazi ukubona ukuthi umuntu ono second degree na kuyaye sesithi buka isikhumba la eshe khona ukuthi kunjani. Uma kuukuthi isikhumba la kuyaye kumile khona inwele bese uyabuka ubone ukuthi usayibona yini i-root yonwele. Uma usayibona i-root yonwele then uyazi ukuthi okay lo muntu kushuthi uno second degree and naleyo degree i-degree esangamanageka ngaphandle kwezinto ezicomplicated. Bese kuba khona ku-third degree, u-third degree ke uyadlula ke udlulele efutheni. Mase udlule efutheni kusuke sekuyiloko esikubiza nge-deep burn. Okusho ukuthi ke lo muntu noma ngabe uzama kangakanani angeke kuze kube umuntu ozokwazi nje ukuthi umtreat ngokumdressa noma ngokumcleana kuphela. Sekuyizinto ezodinga ukuthi umuntu ayiswe ke-theatre ayocleanwa asikwe kususwe lezo zinto lezo isikhumba leso esishile kumbe esifile. Then u-fourth degree ke all the way isikhumba sonke sishile waze wayodlulela kuyimasela or kwesinye isikhathi nasethanjeni ekutheni ke umuntu ke ushe isikhathi eside kangakanani nokuthi leyo nto imshisayo beyishisa kakhulu kangakanani. Bese ke kuba khona Enye ke ibheni singayinaki or abantu abangacabanga ukuthi ibheni isibiza ngokuthi inhalation ban, njengoba uMs T eshilo athi yena bamvalela ekamereni balayitha umetshisi bamshiya kanjalo, njengoba wayese roomini leyo. Angithi bekusha yena nomntwana kodwa futhi kusha nempahla lezo elapha endlini. Uma kusha uyayubona ukuthi akube khona umlilo or kube khona intuthu, intuthu leyo uyayihogela njengoba usuku ukhala or uhayiza ukuthi mhlawumbe ufuna usizo or ukhala ngoba uzwa izinhlungu, uyayihogela leyo ntuthu. And leyo ntuthu uma uyihogela ishisa imigudu yokuphefumula kumbe ishisa umphimbo wakho wokuphefumula, bese nakhona ekutheni uhlala isikhathi esingakanani kuleyo ndawo enentuthu, iyaye ikwazi nokuthi izidlulele ize ifike ngisho nasemaphashini. So lokho ke bese sikubiza nge-inhalational ban. Leyo ibheni serious ukudlula wonke ngoba ibheni enganakekile ngoba awuboni, angithi awuboni lutho ngaphandle ukuthi umuntu ushilo. Wena uzoze uyibone ngokuthi umuntu mayithi uyakhwehlela noma uthi uyambuka umnyama emakhaleni o emlonyeni o mayikhwehlela ukuphuma isikhwehlela esimnyama.
Okay. Siyakuzwa Mrs. Dokotela. Manje ngifuna ukwazi la njengoba uthe le inhalation bans ibaluleke kakhulu. Siyabona khona manje ugesi uyadura, abantu benza izinyokanyoka, bese kuba khona electric shock. Ngabe ibungozi kangakanani electric shock? Or ama-electric bans?
Ama-electric bans now are complicated. Why ngithi complicated? Ugesi ne siyayithi it takes the path of least resistance. Ngisho ukuthini ngalokho? Uma ushaba ugesi ngeke uzubone esikhundeni ukuthi ushile ngoba ugesi ugijima ngaphakathi. Uhamba trying lezinto lezi, uhamba ngamamasela, uhamba ngemsipha. Lezo zinto lezi awuziboni ukuthi ishile. Wena uyitshela ukuthi hayi ungene nje wadlula. So imasela, you can imagine amamasela esinawo ukuthi mangakanani emzimbeni, and imasela elibaluleke ukudlula wonke inhliziyo. So mawusha ugesi ungayimisa inhliziyo yakho as much as ukwazi ukuthi uphinde uyistart. So inhliziyo futhi ugesi uyakwazi ukuthi uyimise. So ama-electric bans, they are very dangerous ngoba angakubulala abantu kodwa bengaboni ukuthi ushile ngenxa yokuthi agijima ugesi ugijima ngaphakathi. Umuntu nje uzobona kunechashaza encane, angithi mhlawumbe sikade ibambile intambo leyo. So uzinechashaza nje elincane la kungene khona ugesi. Umuntu athi akalimele lo muntu, kanti ugesi ungene la wahamba ngaphakathi wagijima ngamamasela wayophuma kwenye indawo. Uzobona nje unechashaza la, unechashaza onyaweni, kanti umuntu ushile ngaphakathi.
Okay. Sibonge kakhulu Dokotela. Sister Mirriam, njengoba Dokotela Pam esechazile ukusha ngama-minor nama-moderate nama-severe. Siyazi ukuthi mawushile ekhaya kuyi-minor, abantu banokufaka ama-Colgate, bafaka ama-Cyanide. Singakutreat kanjani ama-minor bans at home, Sister Mirriam?
Okay, ke balaleli emakhaya lenganixwayisa ngako ukutreat ama-bans emakhaya. Kuthi lesikhathi lokubona ngaso ukuthi umntwana ulimele noma umuntu omdala ushile. Bekumele ukwazi ukuthi siphuthumise kakhulu masinyane emandini labanzako. La uyokhula khona lo mlilo ngoba lo mlilo la ushe khona kuyashisa vele uba ngathi lo mlilo solo uhleli. Uzameke ku-avoid lokufaka ama-sunlight, tonke letinto leti ngobe na ufaka leti nalokubhasta lama-blister kuwaqhamisa lawo mandi lafoma kulama-blister lawo nekhathi uwapushuta lawo mandi lawo-ke u-expose lesikhumba sakho lesilange phakathi kuma-infection selesilonza sakho noma besawumane sisheshe siphole mara because wena sosivulile sowuvulele ukuthi emagqiwane ahlale lapho lawo magciwane lawo kade aku-end up uba ne-infection leti abayisevere leti awudinga ukuthi ube nesikhathi leside uba ku-treatment yokutreat-a lawo mawundi lawo. Kanti nangabe uthi uyabona ukuthi leyo phathi yemtimba ishile, iphuthumise emandini, uyibeke emandini lapho nangabe unema-ice, faka ama-ice kulawo mandi lawo. Kana unema-ice pack ufake i-ice pack. Kungako e-clinic nanginika ama-health education ngithi ngiyabathi emakhaya njengoba ngise-village akusilula ukuthi bathole ama-bench shelves because ayakhosta mara i-ice pack ungaba nayo e-fridge likhaya most inyalo sebanawo ema-ice. Apply leyo ice pack leyo. Now ne bench shield then you just apply leyo bench shield just to cool down the area letabe ishile ukuthi lo mlilo ungawuva ukufunisa into letiningi. Nangabe ukhona kune paracetamol ekuthiwa ipanado. That's the simple muthi lo ngawunatha ekhaya masinyane just kwehlisa lobo buhlungu. Now ubona ukuthi lo buhlungu lobo unbearable abubheketeleki. Uma kune clinic ledutane nawe phuthumele clinic uyokukhona kuthola usizo. Kuba wena unga-add ama-Colgate, u-add amaqanza, u-add tonke into leti damage leso sikhumba sakho njengoba udokotela sashilo ukuthi kunama-degrees alobusha kuyadependa ukuthi ushe kanganani. Wena uve ulomunye athi ushithola ukuthi bekamane washe kancane wathi u-apply sunlight kwanyamalala. Wena ushele sikhumba sakho siphumile lapho ulandzela leyo sunlight leyo uyafaka. Sunlight remember insipho. Nyalo expose le area layo lo shebuyo kuma gciwane la magcile leso silonzela soko is area sokubheka seliphakathi kwende silonzela esikhulu kanti kube ngawe wena vele waphuthumela emtholampilo lodvutane noma clinic la utokhona kuthola isito khona balalele emakhaya lenixwayisa ngakuthi singalaleli ukuthi loya wabuthe kanjani thola isito lokungilona lona ukuthi utokhona ukuthi usiteke ngendlela lekungiyona yona.
Sibonge lapho Sister Mirriam. Mrs. T, ngikuzwe uthi wathi mawuceda ukuthola ukuthi usasha wase uzithela ngamanzi and then why nini esibhedlela?
Esibhedlela ngayiswa the very same few hours.
Okay.
Ekutheni sisave umntwana lo bekasesengaphakathi and then umlilo usumkhulu. So i-ambulance ibikhona laphayana, firefighters they were there trying to rescue umntwana kuleyo room egcwele smoke and flames and everything.
Dr. Mathebula, umuntu sekafikile esibhedlela with amabhensi ngokuhlukahlukana kwabo. Ngabe nina nibodokotela niwatreata kanjani?
Okay, umuntu efika esibhedlela into yokuqala ke sifuneka siyenze ukuthi senze sure ukuthi whatever ibushisile ayisekho angithi. So mayishiso amanzi asukile, umayishiso umlilo stophiwe simkhumule nalezo impahla lezo ayigqokile ngesikhathi eshe ngoba zisuke sisabambe ukushisa so sizoqhubeka nokushisa ngoba njengoba ke washo I think beku sister not uMr usister Mirriam.
Sister Mirriam, okay, yes.
Ukuthi kufanele ufake amanzi abandayo khona uzopholisa la ushe khona. So cooling off is important. Kodwa as much as the cooling off is important, kuyafuneka ukukhumbule ezwela ukuthi uluza ukushisa emzimbeni ngoba njengoba ushile isikhumba sesiba exposed. So ke kuphuma amanzi, kuphume nokushisa. So ushile yebo kodwa kufanele ufudumale at the same time. Asifuni ukuthi ubande ugcine sewuba nento ekuthiwa i-hypothermia. Okunye ubaluleke kudlula konke i-pain control. So kufanele umuntu athole into ezodambisa izinhlungu uma umuntu eshile. Ama-burns ke kuya ngokuthi ke usheka kangakanani. The deeper the burn, the less painful. Ngiyazi ukuthi akuyenzi sense lokho mangikusho. Indaba ngisho kanje. Uma isase superficial, ushe isikhumba nje la ngaphezulu kuphela. It's most sensitive, so kubhlungu. Second degree burn, nawo ushile usashe ngaphezulu ukuthi ukungena nje kancane kodwa kwangadlula efutheni. So ama pain receptors or ama nerve endings asase intact. So nako lokho kubhlungu. Mase siqala zithi third degree ipain yakhona iya ngokuyayehla ngoba manje sewuya deeper into ama layers okusho ukuthi nama nerve endings ayasha. U-third lo fourth degree burn, actually u-fourth degree burn i-patient isuke ingasena pain. Yindaba ingena pain ngoba ama nerve endings ashile themselves. Hayi kodwa ngoba kuukuthi ipain ayizwa ipain okwangempela. Ayizwe pain ngoba ama nerves ashile kodwa kona uzoba nayo ipain which is just phantom or referred pain at later stage. Kodwa wonke umuntu oshile regardless of i-degree kuyafuna ukuthi umnike something ye-pain ngoba kubuhlungu. Bese-ke most importantly fluid management is very important uma umuntu eshile ngoba uma ushile njengoba ngishilo isikhumba siyasuka kuphuma amanzi kuphume nokushisa esikhumbeni and uma uluza amanzi emzimbeni siba dehydrated and uma uba dehydrated then you know izinto ezizolandela so uzodinga amanzi amaningi uma ungena wathola amanzi izinto zakho igcina sezilimele bese ugcina umuntu esedinga dialysis at some point mhlawumbe agcine esedinga ngisho izinto ezifana no kidney transplant and siyazi lezo zinto ukuthi eSouth Africa asizitholi kalula so ingakho kuyafuna ukuthi umuntu mayishile enze sure ukuthi amanzi fluid it's very important whether uyamphuzisa or umfaka ngedrip kodwa ke uma usesibhedlela akubi lula ukuthi sithi phuza ngomlomo amanzi ngoba ngithi ke ngoba kufuneka sikise theater manje kufuneka ustave beforehand so it's much easier ke ukuthi sikufake ngama drip amanzi and amanzi sikunika wona after ushile it's a lot so angeke akusiyona into ongakwazi ukuthi uvele nje uyithathe ngomlomo so ingakho isikunike ngama drip. The higher the percentage the higher the amount yamanzi ozoyidinga so uma for instance uthole u10% wama-bends amount ama-fluids ozoyithola ayifani nomuntu oshe u25% wama-bends so ilokhu engakusho nge-treatment. Bese-ke njengoba ngisho ke ezinye izinto-ke ezizayo-ke ama-dressings lapho Sister Mirriam khona beba khona involved bese-ke kuba khona nezinto esibiza ngama-debridement or ama-scapectomies la sisuke sesisusa khona-ke isikhumba lesi esishile ngoba isikhumba masesishile sifile asizukusebenzela and uma sesishile bese siba yi-source of infection okuyiyona leyo sisuke sizama ukuyi-prevent ingakho siyafuna ukuthi siyisuse.
Sidlulele phambili ku Dr. Nombulelo. Ngiyazi namanje senza lokho vele naseyibhedlela ukuthi before bawufika kuma plastic surgery ama patient ahlala nathi isikhathi kanti maybe khona lokho ku wrong esikwenzayo kufanele abantu abashile baye nini kini as a plastic surgeon.
Like Dr. Mathebula eshilo ukuthi kuma-bends kubalekile ukuthi uqala kanjani management yakho and uyiqala nini. So kubalekile ukuthi you do things right from ekuqaleni. Uyabo. So ukuthi which bends ezithunyelwa ukuthi kuma-plastic surgeons and then which patients it really depends ukuthi i-patient ishe kuphi ishe kangakanani na. I-plastic surgery we divide it into ama-forms awu-2. We say ukuthi form and function. So mase sikhuluma nge-function manje ukuthi for instance usually mawukhuluma nathi ama-plastic surgeons sathi hayi sifuna ukulinda ukuthi ama-scars amachore and then we can do a reconstruction. But in areas now where function your patient is compromised, lapho manje siya khona even if it's earlier. For instance, if umuntu ushebusweni and manje unento sithi ectropion or amehlo akavaleki kahle. If lokho kwenzeka, they can get the drying of the cornea and then izo affecta ukuthi babone kahle. So in those instances we reconstruct early. Sibathathe, then we make sure ukuthi sibasa e-theater, release ama contractures early to preserve the function. So we intervene early, we intervene in the intermediate phase and even in the late phase. When do we intervene early? Ulama patients, for instance, if bashe izandla, we don't want to wait up until they develop ama contractures. They can't use iminwe yabo, or by the time they come, we can't really help them in terms of this joint stiffness. So we intervene early lapho. In terms of the face as well, we sifuna ukuthi lama patients lawo are referred early ukuthi so that we can assess ukuthi yini esingayi preserve. Even net debridement yabo, we tend to be more conservative because sifuna ukunikeza a chance after resuscitation ukuthi do we need, how much can we preserve of the special tissues so that si prevent deform patients with just debridement. And then also in the genital areas as well. So even nalapho we want to intervene early so that sibone ukuthi, because sometimes when our colleagues they go in before Tina, they become aggressive kuma debridement. So sifuna assess sibone ukuthi okay, this one sifuna intervene manje, or is it something that can wait in the intermediate phase. When is the intermediate phase? It's when manje ama-burns might say izilonda zivalekile, whether it's via the skin graft or zona ngokwazo they got re-epithelialization. So, but now that is the area that is between 3 weeks and 12 months. That is the intermediate phase. When do we intervene? Kulapho maybe on the ezandleni kuma joints, because abanye angithi because of pain, maybe they didn't get occupational therapy, or they didn't use ama-splints ebebawinikiwe, so bazama ukuzigokosa so that they don't feel pain. So they end up now developing ama-contractures, whether it's on the elbow, whether it's axilla or esandleni. So those ones we need to intervene early as well to preserve function yellow joint zabo. So then we do contracture release, and then some procedures, whether ngama flaps or skin graft, depending ukuthi how much of the local tissues are still available at our disposal. And then once now the function is preserved, that is now after 12 months, now those ones are chronic scars. That's when now we decide that they can either heal their own normal scars, or by what we call hypertrophic scars, or others they develop keloids, depending on how the burns were managed before and the depth of the burns. So even now we classify them, which, okay, this one is just a normal scar, it's not hypertrophied, there's no flexion contracture. So maybe we just need to flatten it a bit. We can treat it with dressings like silicone dressings. We can treat it even with the injections like steroids, like injection, just to make sure that the tissues are soft and pliable before we can even reconstruct. Then especially those who are not done skin graft, then bazo develop keloids now. Then we need to intervene even then, that we need to excise keloids, and then we need to do either skin graft after the keloids, or we do serial excisions keloids up until the whole tumor keloid is completely cleared. Then now we can address the cosmetic side. So like I said, that is the function first, then the form.
Yes.
So once we've addressed the functions, we form okay, how can we improve? Because but because of the contractures, maybe the commissure is the mouth is leaking, and then so we need to go in and restore the function or the oral competency. So, and then now in terms of their appearance now, that's when now we can start coming in. Okay, do we need to do fat graft, Lana? Do we need to augment the shape of the eyes and all of those things, depending on what complications? So just to answer your questions, we are involved in all the stages, whether it's acute management, intermediate, and also chronic stage.
Sibonge kakhulu Dr. Nombulelo. You know, uchaze kahle lento ukuthi fanele nibizwe early ukuze intervene early. And enye into phela thina ama plastic surgeons sazi nje ukuthi nina change impumulo, you change imilomo, but namhlanje sifunde kakhulu ukuthi you play a major critical role kubantu abashile. Mrs. T, akusichazela ukuthi uma usungena esibhedlela, which treatment did you get?
Doctor, ngiyabonga. I can't say exactly what happened because I was sleeping the entire time, like 6, 7, 8 months. When I woke up, most of my skin grafts were done. Everything was done. What I knew was I was on life support, and they were feeding me with a tube. That's the only thing I woke up to realizing. But step by step, I just learned. Maseng nizophola ngiphuma a year later, okay, they've done this, they've done that. I've had few reconstructive done, like my lower lip was being operated. Still now, Dr. you get my lips are 7-10 because mine were 4th degree, like they were bent completely. They tried to do whatever, but they're still leaking when you eat. You can't eat in public. You have to make sure that even when you eat, you put your food deep inside. And I lost my lobes as well. Getting my, reconstructive is very, very expensive. And it's so sad because burn survivors, most of them, they can't afford it. And the most, in my group, I have more than 500 burn survivors who can afford only to fix contractures, because when you go to the hospital, they'll put in this long list that you wait and wait. You end up getting used to living with the conditions that you have and living with the contractures that you have, because you keep on going to the hospital. They put in a long list, So there's still a whole lot of improvements that need to be done medically when it comes to burn survivors. I'm a third degree, 80%, and people still think I burnt yesterday, and it's 12 years later, but I still look like I burnt yesterday because I'm a third degree. My face was deeply burnt, and it's still tight. Even today, you'll think I'm wearing Botox, and I'm not. But we're trying everything. We have a dermatologist that is helping us just to loosen up the skin and everything, luckily for free. But there are some things that angeka khona ukwalungisa. But we are thinking, hopefully we'll get there medically when it comes to burns.
Sibonge Mrs. T. Dr. Nombulelo, njengoba umbuka Mrs. T kulesimo akuso khona manje. Yes, bamsizile abodokotela lapha abangasiza khona. As a plastic surgeon, kukhona mhlambe okunye ebeningakwenza or eningakwenza kulesimo akuso khona manje. And ngiya understand nje it's because maybe njengoba ukuthi bathatha isikhathi isibhedlela kunama queue. Is it because of ama plastic surgeon nibancane noma kwenziwa yini ukuthi kuthatha isikhathi ukuthi bathole usizo olufika kinini?
I think each challenge she's correct we've got a long waiting list. And then in the public sector, we tend to prioritize reconstruction over our cosmetics. Ne? But under that reconstruction, we've got a long list. We have our patients with cancers that we can't have a waiting list of my cancers. So for them, they always take the priority. And would have or other benign tumors or other conditions like neurofibromatosis. So we've got all those different limbs that we need to save. So now we need to prioritize now what is life-threatening. Then that takes more of the priority. For instance, if we have 2 lists a week, then out of those 2, that there must always be a cancer patient. And then the other reconstructions, then we need to take maybe 1 or 2 we add there. So if you have got more than 200 patients on the waiting list, it is not unusual that the patients can wait even 3 years for reconstruction, especially if it's something that is not life-threatening, even though it causes functional impairment. So it is, one of them is because of the staffing and also theater time.
Okay, vakala dokotela. Manje masenicedile nina ukubatreata, akhona yini amanye ama complications adevelopayo after senenzi i plastic surgery or ni bathini nenze I skin graft, kuba khona yini amanye ama complication angadevelopa? What are they supposed to do post treatment kahle hle fanele basinakekele kanjani?
Okay, it really depends ukuthi patient how the severity of the burns, ama percentage ukuthi be affected how much emzimbeni, which areas were affected. And then once now we come to that, and then we need to stage ama procedures. Angeke senze yonke into all at once. So prioritize. For instance, if une contracture ye axilla, ne ye elbow, even the wrist, we're going to start with the most proximal one. So just to try to improve function. So we stage them. Ideally, we need to stage them between 3 to 6 months, but sometimes they even wait 2 years in between procedures. And then once we're done with that we come to the face as well. That, okay, what is important? Like I said, that with the eyes, feeding, the ears, so all those things, they take the priority just to improve the function. So it can take, it's a journey. It's not like mawufika now it's your turn ukuthi we take you to theater sizokwenza yonke into. No. So prioritize ukuthi which function is affected the most. Because remember, every surgery it carries a risk. Kunaba nama complications. For instance, if we share both hands, we can't do both at the same time because you still want to eat, you still want to help yourself when you go to the bathroom and all of those things. So see our stage alama procedures up until we get to a point which, okay, this is the best possible results that we can offer you. And then we still follow these patients up. And then one of the most feared complications years after the burns is what we call Majolin's ulcer, which is a squamous cell carcinoma because of the chronic inflammation in that area of burns, especially if a patient is being a skin graft. So we also educate them about this, even if it's 10 years later, ukula islonda, ubon ukuthi asipoli, come back so as when the biopsy check ukuthi kwenzakalani na, because we're not sure is it aggressive, the tumor itself, or because our patients, they present late because they are not informed, because most of them, by the time they present, lymph nodes, so there's regional metastasis, it tend to be more aggressive. So we try to empower them. So usually burns patients, we don't entirely discharge them from our care.
Okay. No, sibonge kakhulu dokotela. Mrs. T, ngicela ukufaka mhlambe ngakuvisa ubuhlungu ngivuse inhlungu zakudala. Wathi uma uqala nje usophuma esibhedlela, uma uthatha isibuko uyibuka, how did you feel? And namhlanje uma ubuka from that time, uqala ukuzibona esibukweni na namhlanje the way ufila kanjani sis?
Truly speaking, ekhaya they made sure that I don't get to the mirror. I had to sneak with a nurse that, when I see my nose and lie about it, because I was curious. And the fact that Besekukdalang understand the condition, I just wanted to see my face because I could see I was pinkish everywhere. And looking at my face, I was like, wow, anyway, not bad. That's fine. At least I'm still alive. Because it took time to digest this whole thing and digest the passing of my daughter during that period where I couldn't even attend. So there was a whole lot of things that I digested while I couldn't do anything on myself. You know, you're on catheter, everything, you just become this cabbage. And once you see yourself in the mirror and you can sit up, all I had was gratitude that I'm alive and all I need is to get out of this bed so I can be out there and enjoy life, because I understood that my face is damaged and it's somehow deformed, but the fact that I fought it and the pain was massive, it's not something that I'll go outside and be sad about it because it's all over. So I was so happy going out where even if being too sabantu, but they couldn't understand the journey that I've traveled through the healing to get to where the pigmentation is not back yet. But the fact that now I went to rehab so that can help me walk again. So me putting my steps out there, walking in public, it didn't even affect me because I just understood that they just need to be taught about burns. That it's not something that is taboo. It's just that people, when they are burned, they go on hiding and think it's not normal to live life. So I refused to be sad, and I felt that I owe it to my daughter to come out and be like, we burned, but I'm still here. Can we live life and choose happiness over it, regardless of how I look? And it started from there, and I never looked back.
Sibonge Mrs. T. Your journey is painful, but it's giving hope komunye ohlele ekhaya namhlanje obeyivalele endlini naye asaba ukuphumela abantwini, kanti futhi iyasifundisa nathi siyabantu ukuthi masihambe emall siyekele ukubheka sibe na that look kini, but sinamukele njengathi wonke umuntu. Ngibonge kakhulu Mrs. T. Sister Mirriam, abantu masebe badischargeile kuba nama-wound, ngeke ngizwe nje masibhala ama-discharge lapha esibhedlela ukuthi go for wound dressing. Omunye afika ekhaya athi usister ujust ushintsha amabhandishi kuphela, ngingashintsha mina ekhaya. Ungachaza ngokuthi kubaluleke ngani lama-wound dressing ukuthi bawenze kubo sister futhi nokuthi bayenze follow up yawo?
Okay ke balaleli lengathanda ukunixwayisa ngako ngokubaleka kakhulu kwebona ama wound dressing eclinic kubo sister. because now what I like it to wound dressing, let's corner assess corner the wound. Is the wound progressing or the wound is deteriorating? Last one, we are pumela pambil or we are move like less long. Moving as cats who does when I system 20 bandage. The expected time like melesponding I was less long as here Paul when I to delay so like I 70 summer product la wrong. We are the infect because the infection it starts when you are treating the wound, sterility. Because when you treat the wound, and you manage to treat as something like a normal thing. You need to make sure the sterility is good, and then usebenzisa some product la right. We observe your wound. The wound yako iya progress iya healer. Kune granulation. Let's say for an example, you need to see the product usebenzisa yona iya. If suiting the wound, then you can change. If let's say, for example, maybe abo gelonet for an example, then you're gonna know man. They want to learn I progress with this product because it's an advanced wound personnel. Then you will able to understand. Then you switch to the correct one so that the ones are less on treaters on. Skona which is Paul. No mundo abuyele back M17 or abuyele back kaya sa right. No balega kulba lele makaya kutsi slonza lalelani nangabe kumele uyosi treater a clinic. Follow it up, ungatithatheli ama chances because you will make lots of mistakes, and those mistakes they're going to cost you. The wound will take long for healing, and it will cause a infection, and then you end up with septicemia. Septicemia is the last stage. You know, say figure to my wound care. La lesions as cause the infection, then say supply into your bloodstream, ganzi. Because loans are less manage gago, but because when I was not discharge your spell that I was mbaboni level system available people publish. But watching a mutulo janjan and a mandila but it's not all about who watch observe. Just check I would say less so because for an example, Ushile different types of bands. Ushile and Ushile deep down. Nyale spell that about for example, no mundo angamoga treat les loves the car. But okay for bands we are a clinic maybe every second day or every third day. This is actually bendela ukuthi ukhona ukuthi sibone ukhona kubona ukuthi siya improve in the loans or as improve when we ahlala ekhaya set discharge as loans al bandage le sticker into the wound that's a skip as pull nalama granulation later khona the loans so set get destroyed because when uhlala isikhathi ungakhetha eclinic into ama bandage
Sibonge kakhulu lapho Sister Mirriam. Dr. Nombulelo, sesesivala nje, ungamxwayisa uthini umbukeli onama bands ekhaya?
Okay, engifuna ukusho nje kumbukeli uma unama bands, whether it's acute bands or ubunawo, then what is charged, ungahlali ekhaya, seek the help. Like Dr. Mathebula ukuthi it's important how we start managing so that we can prevent complications. So it's important ukuthi and then masesini discharge ile noba ubona ukuthi wound yakho ipholile so kuhlala if une follow up keep on coming because sometimes siqala kahle and then masesiba discharge umuntu angacomply asebenzisa ama splints wakhe manje uzobuya sekulate senama contractures and all of that. So it's very important ukuthi ama patients they must comply with treatment esibanikeza yona. We try to treat them in terms of multidisciplinary ukuthi sinama physiotherapists kuma team wethu sinama occupational therapists, we've got our plastic surgeons, dietitians, all of that it is to help you. So masinikeza this management plan, this is a journey, we can work it with you. So now nama psychologists because we understand ukuthi sometimes it can be a bit overwhelming which manje this is gonna you must adjust now to this lifestyle ongayijwayele if in your family. So there is those the measures that we've put in place ukuze sikhona ukuthi sinisize. So ngiyacela ukuthi abalaleli ekhaya ukuthi ba comply nge-treatment plan esibanikezela yona so that we can get the best possible outcome for bona.
Sibonge kakhulu. Mrs. T, ungathini kumbukeli osekhaya sesigoqa nje umbukeli osabayo ukuphumela ngaphandle because of ama bands akhe asebusweni kanti futhi nje leviki leli khona intombazanyana ebulewe kabuhlungu ngegender based violence ungaxwayisa isizwe uthini ngalokhu okukwehlele wena ukuthi mhlambe sizame ukuthi sikustope lokho?
Mina engizothanda ukukusho based on domestic violence and ama-scars and how we look. One thing is impilo iyaqhubeka. You don't have to look like the model esiwabonayo. Indlela yakho ekhethiwe uNkulunkulu ukuthi uyihambe and ukutrustile ukuthi uzoba strong ukuyihamba. So the more you hiding yourself, you hiding your healing. So impilo kamele iqhubeke. Mangabe umfana uyindoda usesi and uzithola ushile futhi thola uncedo masinyane ukuthi uzokhona ukuthi the more nakhona the wound stays is the more ukuthi izokhosa iscar. So the more easier you get help is the easier uzokhona ukuphola. And for those who are suffering scars, ama-keloids nani akhona ama-pressure garments. Even if we can't afford to go to the doctors and fix ourselves, believe me, ama-pressure garments ayasebenza kakhulu. Uyakhona ukuwathola once off, last almost 2 years. When you're wearing them, you end up your scars are flat and soft and healing. So don't just sit there, go out, seek help. It's khona thina bo-Miss T. I've walked this journey for a very long time that I could call myself a scar doctor now.
Sibonge kakhulu Mrs. T, sibonge kakhulu. Sis Mirriam, I believe prevention is better than cure. Akusithathe nje usibeke sisi ukuthi singawapreventa kanjani ama-burns.
Okay, balaleli lenganixwayisa ngako ukupreventa ama-burns. Kuba careful kakhulu kubalulekile. Esikakhulukazi kunalenye lesingakayimentionanga ama-burns afana ngike ngaba nalenye i-patient le yayishe ku-overheating yemoto. Ibone into uthi iphume emotini and then wagijima masinyane wavula ibonnet and nekavula ibonnet then aphuma amanti. I don't know how it go. Bamphuthumisa bamtisa kimi eclinic only to find out because I'm the only sister at clinic. I just resuscitated him masinyane. I kept him warm and then one of the drivers emgwaqweni with taxi and then I can't drive the patient and then because the ambulance it takes time as in say village because bamphuthumisa esibhedlela. So lenganixwayisa ngabo ukuthi into lethi njengale la ubona khona ukuthi kunebungoti, please try and stay away from it. And then lokunye nalama steaming, the steaming nyalo because you're trying to prevent yourself from getting ama-COVID. Ngike ngaba na one of the old lady legathi uyastima and then ubeke le usangena ngengubo uthi ufuna kuthela ebhavini then lelinyawo lakhe laka right na tripper that container le ayithwelela mandi lashisayo, the whole leg got burned. So these are the things that kumele nithi iqaphele kakhulu balaleli ukuthi nabantwana ningabathumi ukuthi bahandlishe amanti lashisako nyalo kuyaba ibusika manje. When you go to bath umntwana, make sure you run cold water first ku basin before you can run the hot water because that can cause a serious burn. Umntwana uyobona ukuthi umthelele amanti ogeza afika jumpe ashe. And then again namatiya ningawabeki iduzane nasematafuleni la umntwana donsa khona limwele ashe tiya lishisako mpholisele umntwana because utofuna ngasathi ujakile uye esikoleni and then ikakhulu emakhaya la kubaswa khona imililo then bantwana bangasonzela iduzane nemlilo just for safety yabo. And then my hot water bottle, especially the diabetic, please don't keep the hot water bottle on your lower legs because you lose your sensation very easily. Uto end up uba nama pressure ulcers and then nama burns. You can end up having your limb amputated. Lokunye futhi ama-plugs, you must have a safety emakhaya abantwana labancane those they are crawling bayafaka amathi ngalo tabo tiyafika ama-plug but then bathola ama-crunch lapho-ke. And nalabantu bezinyokanyoka emakhaya, please try stay away from kumesapha nama-electric wires. If you are not qualified to do any electric thing, ungazami kuhlanganisa tinzambo, that can cause a serious burn. And lokunye futhi lengaxwayisa kakhulu it's ama timbawula tingalali edlala khona because it dries out even your oxygen. And then nama heater ema bathroom, please try to avoid ama heater ema bathroom. Now wathi ukuthi noma kuyabanza make sure ukuthi i-heater manje uyibeke ku bedroom uyongena kumasinyane kushawa ebhavini ugeze masinyane ubuye ngala because nyalo lamanda yashisa lapha nehita ilapha, you drying out your oxygen, uyophefumula in manje, you will cause illnesses and then many things lokungendakala balalele emakhaya. Ngiko lenganixwayisa ngakho.
Kanti uma sesigoqa nje dokotela ungaxwayisa uthini kubabukeli ababukeli emakhaya ngama-beds?
Ama-beds izinto ezincane ezikhoza ama-beds. Yindaba ngithi izinto ezincane, uplug iketela, uthi wenza amanzi, ubeka amanzi eti, uphenduke ubheke eceleni, iqhamuka ingane idonsa iketela. So izinto ezincane njengalezo kufanele uziqaphele. Uma kuwukuthi ubeka amanzi ashisayo, hlala lapho up until abile amanzi, uwasuse wena uwayise endaweni ephephile. Ungathi ngiyacisha ngizobuya ngibuye ngoba wazi ukuthi uba nolandela emva kwakho. Iketela ungalishili namanzi ashisayo. Iketela masuqedile ukusebenzisa lokho kade ukusebenzisa, wenza inkomishi yakho yetiye, wachithe amanzi, ulisuse iketela lapho eduze nomntwana, ulicishe neketela odongeni ngoba awazi ukuthi umntwana uzofika yenzeni. Ngoba uzothi uchitha amanzi ushiye iketela kodwa ulicishile odongeni, afike umntwana ngoba uyazi ukuthi wena uyafika ukhanyisa, afika akhanyise la kanti iketela li-empty. The next thing uyaqhuma, uma qhuma kwenzakalani? Kuyasha endlini, sekuba nomunye umlilo lapho. So izinto ezincane njengalezo kuyafuneka siyinake. Isitofu sicishe odongeni, ungacishi kuphela la ubona khona ngoba umntwana uzofika adlale. Kwesinye isikhathi umntwana uthola abantwana bayayidlalela bodwa, angene avinini omunye angithi badlala umacashelane, ucashile lokho avini, afike omunye uzovula akhanyise kanti kunomntwana esitofini. Umntwana yabo izinto ezincane. Iy'ntambo zikagesi, kungabi ney'ntambo ey'hleli nje isinome kanjani ngoba kuzoshaya ugesi ngoba njengoba ngithi futhi ugesi ubucayi ngale ndlela yokuthi awuboni ukuthi umuntu ulimele kangakanani ngoba ugijima ngamamasela. So izinto ey'fana nje ezinye okuyishile ku-Sister Mirriam ukuthi nje ungalali nembawula, ungalali nehitha ikhanya, ikhandlela bakwethu, ikhandlela ngoba akusiwona wonke umuntu onogesi, akusiwona wonke umuntu onegesi, kodwa nje ikhandlela, gadi ikhandlela, licishwe ikhandlela noma lihlala endaweni la ukuthi lingabambi ikhethini, umlilo ugijima ekhethini. Abasebenzisa amagesi nazo lezo zinto lezo wenza sure ukuthi i-room is well ventilated ngoba igesi nayo inga-explode ikhoze umlilo lana endlini. Bese nalabo abasebenzisa i-primer stove nayo ugadi ngoba lezo nazo ziyaqhuma zikhoze ama-burns.
Sibonge kakhulu Dr. Mathebula, sibonge nolwazi oluphile kubabukeli emakhaya. Sithembe konke lokho sibafundise khona bazokwenza bakulandele. Sibonge kakhulu Sister Mirriam Zahoor, ngibonge kakhulu Dr. Nombulelo Metuse, nakuwe Dr. Pam Mathebula, nakuwe Mrs. T. Ngibonga ngaqedi ngalolu sifundo enisifundise ababukeli emakhaya. Ngibonga kakhulu isikhathi senu. Kanti ke njengoba uDr. Nombulelo eshilo ukuthi kuba nama occupational therapist, ama physiotherapist aba-involved, sisazoqhubeka kahle nesifundo sethu sama-bands. Sesibiza bona ke ama physiotherapist asitshele ukuthi bona nama occupational therapist bayitreata kanjani ama-bands. Nisale kahle emakhaya.